Hi, everybody. This is Dr. Lewis Cady speaking to you live from Cady Wellness Institute in Newburgh, Indiana. It's my pleasure to present to those attending the Global Autism Summit on the natural treatment of ADHD, both for patients and sometimes adults, if you're watching this, if you have it, who have ADHD themselves, or their children have ADHD, or their children or teens have ADHD and autism. So that is kind of how I constructed this presentation. It's good to have you here. I'm going to minimize my camera and we will start the presentation. So welcome again. That's Cady Wellness Institute there. Let's get moving. So I am a psychiatrist, and I am one of those evil pill-pushing folk that Peter Bregan talked about in Toxic Psychiatry. People have railed against in Ritalin-free kids and so forth. I'm not ready to give up my medications, but I do not want to overly rely on them. And so this presentation will be about how to not overly rely on medications. Let us begin with a discussion of ADHD, how much and why so much. And also, let's take note of the fact that drug therapy has been going up. This was a study in pediatrics in 1996, noting a 2.5-fold increase in Ritalin treatment between 1990 and 1995. And the reason for the increase in methylphenidate or Ritalin seems largely related to people are getting treated longer, more girls, adolescents, and inattentive youths are getting medication, and a recently improved public image of medication treatment. For both groups of people hearing this presentation, I'm going to start with the parents or patients with straight ADD, ADHD. Medications are not necessarily evil, but I'm not going to talk about medications in this presentation, except in passing. Holistic biomedical interventions are more desirable, and some interventions that patients with autism receive, and all functional testing may all be relevant in terms of remediating the biological symptoms exacerbating ADHD. For parents and patients with ASD and ADD, ADHD, in terms of teasing through how to approach this, my bias is always to select the most disabling set of symptoms and try to start stabilizing them first. So if the autism spectrum disorder is mild, but the child simply can't concentrate, then it would be reasonable to start dealing with the ADHD or ADD first. If the ADD, ADHD is the least of the child's problems, and the child is doing the typical and unfortunate autistic regress behaviors, flapping, stimming, emotionally unavailable, etc., then obviously the autism and autism spectrum disorder should be addressed first. Medication should be used only with caution and not unless absolutely necessary for chemical restraint. For self-injurious people that would actually injure themselves or someone else, I will mention that risperidone has been FDA approved for disruptive behavior disorder and also in autism, but I truly try to stay away from that. My philosophy is let's try the holistic things first. So as of this morning, April 11th, when this is recorded live, there were 2,751 citations in the peer-reviewed literature dealing with the overlap between autism and ADHD. Recent literature has noted that prenatal exposure to substances resulted in more mental health symptoms associated with ADHD and autism spectrum disorders compared to control. There is a new technique, the empowered brain system, and this was just published last month, March 2018, using these augmented reality smart glasses for young adults with ASD and high ADHD symptoms. And these smart glasses seem to work. So that's something for further exploration. Also, children with both ASD and ADHD have an increased risk of anxiety and mood disorders, and doctors and other healthcare professionals who care for these children should be aware of it. Now let's talk about ADD, ADHD per se, and why stabilization and remediation of symptoms is so important. Back in 2003, I began seeing these newspaper articles that more technology jobs were moving overseas. This is what's happened in U.S. manufacturing jobs from 2000 to 2009, and the manufacturing jobs that do not require a huge amount of education are dropping off. This is a study on productivity versus employment. So industrial production, as you can see, is going up beautifully, but manufacturing jobs are going down. And the reason is people are being replaced with robots. And if you cannot focus, cannot think, cannot make your grades, and you can't get a job because you've been replaced with a robot, you will have problems. So there is more emphasis on treating and diagnosing early and stabilizing. And again, I will emphasize, not necessarily with pills and medications. There's the manufacturing jobs going down and the industrial production going up. That is a big X of unemployment right there. So as I've been wandering around recently, I've noted where the jobs are going. This is me checking out at a local supermarket that the checker has been replaced with a machine. This is the Evansville Regional Airport, where you can see the booth in the middle is empty and it says credit card only in the second lane. That person has been replaced with a machine. People that are laying bricks have been replaced with a machine. Highway workers that lay asphalt have been replaced with machines. I mean, we still need some, but not as many. So I think, and it's just critical for people to be able to interact with their environment and process things. Amazon has replaced checkers with machines. It's an increasingly complicated society out there. This is the Atlanta airport, and you have to be able to read and process quickly to figure out where you're going. So for that reason, you can see the title there, and I couldn't resist putting this in here, will work for milk. But increasingly, people are going to have problems with employment if they cannot think, process, sit still, focus, and get their lessons done. And Tyler Cowen, in his book, Average is Over, talked about how the middle class is getting eroded and will continue to get further eroded with robotics and automation. So it's kind of a warning to all of us about what may be coming. When we look at genetic tendencies in ADHD, we will see that the apple does not fall far from the tree. There's a huge biological inheritance of ADHD. And when we look at the research, we will see here panic disorder, schizophrenia, ADHD, and height, and the hereditability. One is perfect hereditability. You will see that ADHD is more hereditable than schizophrenia or panic disorder and is only surpassed by height. So one's genetics have a significant amount to do with whether or not you've got ADD or ADHD or not, and we will further explore that as we go on in this webinar. Genetic etiologies are associated with genes which involve dopamine. And the positron emission tomography, or PET studies, show that there is excessive dopamine active transport in the presynaptic neuron. In other words, the pitching neuron sucks up the dopamine much faster than it should, resulting in not as much dopamine floating around. Dopamine is the pay attention and focus neurochemical, as well as the pleasure neurochemical. So I thought I would put something in here about what does ADHD, ADD look like in the brain. And this is from my association with Dr. Daniel Amen, whom I met in California some years back, and he toured me through his brain SPECT imaging clinic. I will tell you that my general MD psychiatric colleagues kind of poo-poo Dr. Amen. I personally think they're jealous. I'm very impressed with the science that he's done, and I'm going to show you some pictures. So here's Dr. Amen in his SPECT scanning reading room, and up there you can see through the window the triple-headed picker SPECT scanner that he uses. This is an ADHD brain at rest, not concentrating. And if you look at the holes up at the top, that's the prefrontal cortex right there, inferior orbital prefrontal cortex. This is the same ADD brain being told to concentrate, and you'll notice that it gets worse. So if you just tell an ADD child to concentrate more, it is not going to work. There is a biological problem in the brain. This is another brain, ADHD concentrating on medication. So here's another description. This is inattentive ADD without medication. This is the same brain on medication, in this case amphetamine. Again, we do not necessarily have to go to medications to remediate the symptoms of ADHD, as will be clear as we proceed through this presentation. So in overview, this is how I suggest people avoid over-reliance on medications. First of all, a holistic evaluation, treatment, and supplementation. If prescribing is done, it should be smart prescribing and not dull, unimaginative, non-creative, non-integrated prescribing, avoiding any awareness of the biochemical verities of a child's existence. School, there should be an excellent working relationship with the school and good teaching. I have had patients referred to me that the teacher thought that they were ADD. And as I took the history, I found out the teacher was dull and the child was not ADD. So good teaching is required. By the way, for any teachers that are listening to this, I do not have it against teachers. My mother was a teacher, my father was a teacher, and I was a teacher. So that being said, good teaching is required. At home, I think it's important to diminish the electronic screens effect, and I've done a lot more reading on that recently, and I'll share some of that with you. Good home discipline, good sleep-wake schedules, good diet and nutrition, and adequate exercise. And then parent training, discipline, coaching, how to deal with stress, etc. Now, this is what the peer-reviewed literature says about internet game playing. If people are playing games on the internet, they have lower white matter density in the brain regions that are involved in decision-making, behavioral inhibition, and emotional regulation. In other words, the ADHD sections of the brain. Structural brain imaging studies show alterations in the volume of what's called the ventral striatum that is an important part of the brain's reward mechanisms, and those mechanisms are driven by dopamine. Video game playing was associated with dopamine release similar in magnitude to those of drugs of abuse. In other words, if you snort cocaine and you shoot out a lot of dopamine versus if you're playing video games and you shoot out a lot of dopamine, there was not a whole lot of difference. So this should give us pause. Video games, it should be noted, are designed for this compulsion loop where you can see the guy pushing the boulder up the hill. If you stop, the boulder goes down. So you have to keep going and going and going, and you have to go to the next level and the next level and the next level, and they are exceptionally addictive. They are designed to be addictive. And people are so addicted that it's fatal. So in 2005, a South Korean lost his job and girlfriend, spent all of his money at an internet cafe, 14 to 18 hours at a time. One day after playing for 50 hours nonstop, he collapsed, died from exhaustion and dehydration. 2015, a Taiwan man was dead from cardiac failure after a 3-day online gaming binge. In 2007, a 15-year-old boy shot both of his parents over the Halo 3 video game, which was confiscated. Later, a 17-year-old Philippine teen murdered his 68-year-old grandmother for having the audacity to interrupt his game playing in an internet cafe. There is clearly an obvious, in-your-face, addictive quality to these games. And in fact, new diagnostic codes have emerged. So in ICD-10, which is used extensively for diagnosis. There are diagnostic codes for keyboard playing video games including cell phones, and even treatment facilities are emerging, such as at McLean Hospital in Massachusetts, and even the Chinese government has opened several clinics to treat those suffering from internet addiction and game addiction. It's worth noting that the same patterns of internet addiction and game addiction and shooting out dopamine are those involving reward and motivation, which is an issue with ADD, ADHD people, pleasure and euphoria, compulsion, perseveration, and decision making. All of these are critical for executive function, and they are mediated by the dopamine pathway in the brain. When you look at dopamine and drug addiction and this brain nucleus, the nucleus accumbens, we will find that addictive drugs increase the extracellular dopamine in the nucleus accumbens, and brain imaging studies have shown that there's a correlation between a psychostimulant-induced increase of extracellular calcium and self-reported measures of liking and high. So stimulants will increase brain dopamine. Video game playing will increase brain dopamine. And now there's the internet gaming disorder, which has been discussed in DSM-5, and the World Health Organization has put down gaming disorder as a new diagnosis in 2018. So I think it really behooves all of us to be aware of this. So, number one, eliminate or vastly minimize the video games. Number two, medication is not the only answer. This is a pharmacist friend of mine, and I thought that in the past, when I started psychiatry, that you just gave people a prescription and that got them all better. It doesn't work that way. So here was actually a study of do stimulant drugs work in children who have both ASD and ADHD. So 113 children were studied, and I want you to pay attention to the emphases on these slides. So first of all, if the child was tolerant of the medication, many weren't. No true magnitude could be definitively determined. There was no evidence that methylphenidate had a negative impact on the core symptoms of autism spectrum disorder, which is good, or that it improves social interaction, stereotypical behavior, or overall ASD. So this is not an overwhelming endorsement of stimulant medication for children with ADD and ASD. My advice in terms of determining what you're going to do is to go into the holy of holies and research the literature yourself. This was an illustration of the old Jewish temple in the Old Testament, and back in those days only the high priest could go in. And previously, before the internet and our easy availability of doing our own research, it was very difficult. But now the holy of holies are available to us. Google.com, scholar.google.com, and pubmed.gov. I'm going to show you this page. I learned about Google Scholar from the great Temple Grandin at one of her lectures. She's an amazing woman, one of my heroes. I've just been using Google. I found that if you look things up on Google Scholar, you get a much better selection of journals, sometimes even better than on PubMed. PubMed is the other place that I hang out. So here are some things that can be done in terms of natural treatments of ADHD. Here was essential fatty acid metabolism in boys with attention deficit hyperactivity disorder. This study looked at 53 subjects with ADHD and found that they had a significantly lower concentration of key fatty acids in the plasma polar lipids than did the 43 control subjects. They also noted the precise reason for lower fatty acid concentrations in some children with ADHD is not clear. And to my knowledge, it has not yet been determined why this is. Here's another article on dietary changes in essential fatty acid ratios and the increase in autism spectrum disorders. This actually puts the fault at the feet of diet. So they argue that a change in the ratio of omega-6, that's what you get from eating the typical American diet, to omega-3, that's what you get from eating fish, especially during early life, may induce developmental changes in brain connectivity, synaptogenesis. That means the genesis or creating of synaptic connections in the brain, cognition and behavior that are directly related, in this case, to autism spectrum disorders. Here's another study. This is about dietary omega-3 fatty acid deficiency and high fructose intake in the development of metabolic syndrome brain. The authors note that the Western diet has deficiency of omega-3 fatty acids and increased fructose intake. Both promote brain insulin resistance and increase the vulnerability to cognitive dysfunction. Multiple cognitive domains are affected by this metabolic syndrome in adults and obese adolescents, with volume losses in the hippocampus, that's the section of the brain for memory, and frontal lobe, that's the section of the brain for executive function. And the fructose is rampant in the high fructose corn syrup additions in our food, our prepared food, as sweeteners, and sometimes it's in food we don't even know that it's being used because you can't taste it. Here's another study of altered serum mono and polyunsaturated fatty acid levels in adults with ADHD. They were noted to have decreased docosahexaenoic acid, DHA, as well as several others, arachidonic acid, DHGLA. These authors demonstrated that a lack of polyunsaturated fatty acids in the blood serum of subjects with ADHD persists into adulthood. They could also show that adult ADHD symptoms positively correlated with elevated levels of basically the bad fatty acids compared to the controls. So I want you to understand there is a huge literature on essential fatty acids in ADHD. This was a view of all the studies that had been done on the reduced levels of omega-3 fatty acids associated with ADHD. And so if you look, and this was back in 2006, if you look over at the left where you see EPA, that's eicosapentaenoic acid. The gray is the control. The blue is the ADHD group. The blue, the ADHD group, have less EPA than the control group. The ADHD group also has less of DHA than the control group. Interestingly, omega-3 fatty acids, PUFAs, the essential fatty acids, PUFA is for polyunsaturated fatty acid, have been found to actually have cognitive enhancing effects. This summary, done in Medical Hypotheses 2012, demonstrates that a deficiency in brain PUFAs will lead to cognitive deficits, while supplementation of PUFAs, that means taking fish oil, can rehabilitate cognitive deficits as manifested in attention deficit hyperactivity disorder, stress, anxiety, and aging. Here are some other studies. Low-dose PUFA supplementation study. It was a French community dwellers age 70 or over. Now, that's probably not the audience that I'm talking to that have concerns, but I want you to understand and see what happened. These people were not demented, and they were reporting subjective memory complaints. 800 milligrams of DHA and 225 milligrams of EPA were added, and these people had less cognitive decline over 36 months. That's significant. This was a study looking at polyunsaturated fatty acids and Ritalin. There were 40 children in this study done in 2014, most were boys. There were two groups, the methylphenidate and the PUFA, and the methylphenidate and the placebo group. The response to treatment, which was defined as a reduction of at least 25% of signs, the methylphenidate and the placebo group got 60% reduction or response to treatment. The methylphenidate and the polyunsaturated fatty acid group got 90%. So that, ladies and gentlemen, is a 50% increase in response based on adding fish oil to a widely prescribed medication. I think that we should pay attention to that. Now, many times I hear my patients say that they're taking flaxseed oil. And it's true that when you look on the back, you see a huge amount of omega-3, like 6,200 milligrams. And what's not to like about that? The problem is that when we look at how that flaxseed oil breaks down and we go up to the top of linoleic acid and alpha-linolenic acid, which is in the flaxseed oil, there is a key enzyme called delta-6 desaturase, which you see right up at the top. And many people are deficient in that. And if they're not deficient in that, they're deficient in some of the required nutrients that make delta-6 desaturase go. Magnesium, zinc, B vitamins, vitamin C, and insulin. So simply because you take flaxseed oil does not mean that at the bottom you're going to drop out with eicosapentaenoic acid, which you see in the middle of the right-hand column, or docosahexaenoic acid, which you see at the bottom right. EPA is frequently thought of as kind of an anti-impulsive, anti-aggressive, anti-manic unsaturated fatty acid. DHA is widely published for improving brain function and dyslexia. So I put this in for online viewing, and I'll tell you at the end of the presentation how you can see all of these slides at your leisure. The key principles of essential fatty acid are: do not use large doses of a generic omega-6 or omega-3 fish oil and presume that you're going to get any benefit from it. The only two sources of fish oil high in polyunsaturated fatty acids are from A, eating fish, or B, taking fish oil. That's it. If we don't eat fish, we should probably be on fish oil. And I'm talking about a lot of fish, like anchovies and sardines, and regular fish like cod or salmon twice a week. We do have the ability to synthesize these critical PUFAs, but in order to do so, we must have adequate amounts of the critical trace minerals. And so we need to eat fish or take fish oil. Now, this I labeled with the brand name Viron, because this is how most of you will ask your doctors about it. And many physicians do not know about this. It is a new prescription medical food specifically for ADHD. It's not a medication in the conventional sense. It's not a stimulant. It's not an antidepressant. It doesn't modify neurotransmitters, but it gets EPA into the brain, and I will show you how that happens. So lipids are important for brain health. There are abnormal lipid balances associated with ADHD. Lipid levels, excuse me, in the blood and brain might be affected by different parameters, and so why not put more of the good stuff in? So here's a phospholipid molecule. Just take a quick look at that. And here's the phospholipid molecule on the left with a serine group put on its head, coupled to either EPA or DHA. If it's coupled extensively to EPA, phosphatidylserine coupled with EPA, that's Viron. That's for ADHD. If it's the phosphatidylserine coupled with the docosahexaenoic acid, that's via COG. That's for older adults with mild cognitive impairment. And both have been studied in double-blind, placebo-controlled studies, and they work. So here was a study about what's the best way to get omega-3 into the mouse brain. On the left is the control, and the bars are how much gets into the mouse brain. The next one is soy phosphatidylserine. Not omega-3 did not get in the brain. Fish oil is the middle column. Soy phosphatidylserine plus fish oil is the next column. No big change there. When you couple phosphatidylserine with omega-3, you are able to get more EPA, more omega-3 into the brain. So that is the whole notion of Viron and Viacog. Moving over to lithium, most of us have heard about lithium as a treatment for bipolar disorder. This remarkable New York Times study, actually not study, it was an article, published in 2014, titled "Should We All Take a Bit of Lithium?" looked at the fact that in areas of the country where there is higher amounts of lithium in the drinking water, there is generally less psychopathology. And conversely, where there are lower levels of lithium in the drinking water, there are higher levels of psychiatric problems, including suicide, homicide, violent crime, etc. So the notion of lithium and whether or not it should be used in a very small amount is useful. This is a hair analysis, and this is one of the best ways you can see what the level of elemental lithium is in the body. The essential elements portion of this test include essential or elemental lithium, iron, magnesium, zinc, and copper. The essential elements are down at the bottom. The toxic elements are up at the top. I just want you to look at the bottom. These 5 elements that I have listed here are critically important in ADHD. And iron, magnesium, zinc, and copper have all been found to be low in patients with ADHD, as I will establish shortly. Iron is the most common of all nutrient deficiencies in U.S. School-age children. Its deficiency is associated with markedly decreased attentiveness, narrower attention span, decreased persistence, and lowered activity level, all of which respond positively to supplementation. Ladies and gentlemen, this is not a methylphenidate deficiency. This is an iron deficiency. And it is wrong to not consider the biological causes, in my opinion. I think it's unquestionably wrong to not consider the biological causes of symptoms in our children and just simply reflexively go toward the prescription pad. And interestingly, in another study, there was a 30% improvement in the Conners ADHD rating scale following iron supplementation. Check out these graphs over here. So before is in red and after is in blue. And this is the significant increases in serum ferritin levels and a significant decrease on the patient's, on the parents' Conners rating scales of these patients. You can see that as the ferritin went up, the symptoms went down. And ferritin is a marker for iron adequacy. Here's 2018 data. This was a meta-analysis to compare ADHD symptoms and iron levels, iron deficiency. 17 articles met the search criteria. The conclusion was that peripheral serum ferritin levels were significantly lower in ADHD children, but with no significant differences in iron or transferrin levels. Now this is interesting. This means, ladies and gentlemen, that if your doctor only checks an iron level on your kid, it may not be adequate, and that the serum ferritin level should be checked. Serum ferritin is something of a referendum on the full body repletion and adequacy of iron stores. So definitely ferritin should be checked. The conclusion was that ADHD is associated with lower serum ferritin levels, and ID is iron deficiency. Zinc, moving on to other elements. In this Polish psychiatric journal, back in 1994, they took note of certain trace elements that are lower in children with hyperactivity. And they noted magnesium, zinc, copper, iron, and calcium in the level of the plasma, the red blood cells, and the urine and hair in 50 children aged from 4 to 13 years of age were examined. The highest deficit of these minerals, these essential minerals, were found in hair. Hair analysis is not commonly done by conventional practitioners, but it is by biomedical practitioners in the holistic integrative ones. Their conclusion was, our results show that it's necessary to supplement trace elements in children with hyperactivity. Obviously, in order to do that, you have to know that those deficiencies exist in the first place, and a hair analysis, particularly for a patient with autism, is remarkably easy to do. It just involves cutting a little hair off the back of the head. It does not involve a traumatic blood draw at a lab. Magnesium is another extremely interesting element. This was a study of 116 children with ADHD. Magnesium deficiency was found in 95% of those examined. And the best place to look for it was the hair. The next best place was the red blood cells. The worst place was the blood serum. The conclusion was that magnesium deficiency in children with ADHD occurs more frequently than in healthy children. And so I would again emphasize that I just think it's unconscionable not to check these things and just reflexively foreclose on a prescription instead of an appropriate elemental supplementation. So here are two cases to put it all together. Sorry for the clearing of the throat. I'm getting over a cold. So Aldous Huxley wrote Brave New World, and it truly is a brave new world in terms of what we can do in terms of testing. This was a child, 7 years of age, who was, I described him as an adorable rager. He was adorable most of the time, but he had unpredictable rages. He was assaultive, and he was intermittently totally unmanageable, with an emphasis on intermittently. When I hear intermittently, I want to know, were there causes for these rages? As it turned out, when I looked at his food allergy testing, there were. So if you look over in the red square, he had high sensitivity to dairy. And if you look at the top right, he had a reasonably high sensitivity to gliadin and gluten. So that was one of my interventions. We also did a pharmacogenomics report, and let me break this down for you slowly. So the first one there is the serotonin transporter, and this lets me know if it would even be reasonable to try using a serotonin reuptake inhibitor in this child. And the answer is no, because he is genetically not capable of having those work. The next is catechol O-methyltransferase, and this is a very interesting enzyme. This is the Val-Val configuration, which is high activity, which basically means this enzyme, COMT, is unfettered to munch down on all of the pay attention, happy, be organized neurotransmitters in the brain. High COMT frequently is associated with worse functioning and also craving and substance abuse, as we'll get to later. The next one shows me that I could use a non-stimulant medication if I wanted to, an alpha-2 agent. And the bottom shows that this child is double heterozygous at MTHFR. Now, don't panic. I will break this down slowly for you. The first gene there that you see is C677T. That is the major gene. The supportive cast is the A1298C. And green is good, red is bad. That means he's got a half-bad genetic endowment on both of those genes. This is the reason that it is important. For my friend Stephen Stahl and his article, L-methylfolate, a vitamin for your monoamines, which actually, if you go to Google and type that in, L-methylfolate, a vitamin for your monoamines, you will go directly to this article. That's the first page. I want to break it down for you slowly. So here is how L-methylfolate is synthesized. You take in folate from your diet, it's converted to dihydrofolate. It goes through this MTHFR gene, if you've got it, and is converted into L-methylfolate. Why should you care? Because L-methylfolate is required to make BH4, tetrahydrobiopterin. Why should you care about that? Because BH4 is required to wake up tyrosine hydroxylase and tryptophan hydroxylase. And when that happens, these enzymes take in tyrosine and tryptophan, respectively, and generate dopamine, norepinephrine, and serotonin. Dopamine and norepinephrine are critically important for executive control and focus, and serotonin is important for mood, decreased obsessionality, and decreased impulsivity. So in order to get the happy neurochemicals, you have to wake up your enzymes. In order to do that, you have to have BH4. In order to do that, you have to have L-methylfolate. And in order to have L-methylfolate, you have to have an adequate amount of MTHFR. These were some other genes that were done. I will direct your attention to the 2D6 isoenzyme. That is the pathway that most psych drugs, including amphetamines, tricyclics, and codeine, break down through. Methylphenidate does not go through these pathways. But for people that are intermediate metabolizers or even poor metabolizers, they can tend to have more side effects and higher levels if an amphetamine drug is used. Now, this presentation would not be complete if, I'm sorry, I'm going to go back, if I didn't go over intestinal microbial overgrowth. And here we see arabinose, which is elevated in the urine of this child. This is an organic acid test, and arabinose is a sugar secreted by yeast. So if you have an excess amount of yeast in your gut, you make too much arabinose, which is absorbed into your bloodstream and peed out in the urine. And then lo and behold, your arabinose level is too high. This is another way that we can look at what's going on. And this child's quinolinic to 5-HIAA ratio was elevated. Quinolinic acid is basically a neurotoxin. If you do not have enough serotonin, the ratio gets out of hand. And the way to get more serotonin is to make sure that the child's MTHFR is balanced. So this is what we did. We eliminated dairy and wheat. Again, this is the 7-year-old adorable rager who was only intermittently rageful. We got rid of the dairy and wheat. We added L-methylfolate, which is an easy supplement to add to bypass his MTHFR problems. I put him on Virin to stabilize his membranes. I put him on 5-HTP to supply more raw material so that he can make more serotonin. And I prescribed lithium drops, 10 drops, 0.5 milligrams, and the child got better and stopped raging. Here's another case. Nothing but marijuana makes me happy. This was from a 14-year-old patient who presented tired and fatigued, a little depressed, somewhat hostile towards the mom, and definitely told me that nothing but weed would make him happy. This is an example of a SpectraCell test. It is a functional intracellular micronutrient analysis. It reminds me of the old Star Trek classic series Sick Bay, where Bones McCoy would be solicitously hovering over the patients, and the little triangular markers would be above their bed showing all of their functions. This is as close as we can get to that for nutrients. So I did one on this child. And then this is another GeneSept assay. And I'm going to break this one down slowly. So this one isn't quite as bad as the first child, but there was an intermediate risk of non-response to an SSRI. So I couldn't make this person who only wanted weed happy with an SSRI. The catechol-O-methyltransferase enzyme, the happy neurochemical munching enzyme, was very high activity. It's as high as you can get. So even if there were some happy neurochemicals floating around, they'd be munched. This person was also deficient, double heterozygous in MTHFR. And this is an interesting finding right here, this mu opioid receptor, which means that if the child had any endogenous opioids for pleasure, they wouldn't have worked very well, because half of his genetics contributed to lack of opioid response. Also, if you're ever in a car wreck or have surgery and you have this configuration, or heaven forbid, the double homozygous GG configuration, opioids will not work, and doctors will think you're a drug seeker because you will keep saying the pain medication doesn't work. This was 2D6, and this young man was a poor metabolizer, which means if I had put him on an SSRI, a common one, the level would have shot through the roof. And not only that, but it wouldn't have made him any better because of his serotonin reuptake transport gene and his COMT. So this is what I decided. He had, again, a heterozygous MTHFR. I put him on L-methylfolate. plus methylated B vitamins and trace iron. Because of his functional intracellular analysis, I found him to be low in selenium and magnesium, so I replaced that. He was slightly subclinically hypothyroid. I added low-dose T3. And I noted that ultra-low-dose bupropion could be started if needed in 2 to 3 weeks. Now, that was then. This is now. I saw that child last year. This morning, as I was preparing for this, I found that rhodiola roseae is a catechol O-methyltransferase inhibitor. And I will show you, no, I won't. I did not put that in here, but there, if you go to that article and look it up, you will find that this herb that you can get at a health food store inhibits COMT, which keeps the enzyme from gobbling up the pay attention, be organized, and be happy neurochemicals. I think that's remarkable. But the only way that you can really deploy this precisely and thoughtfully is if you have the pharmacogenomic testing done. Treatment of side effects. Many of you know that sometimes kids that are treated with medications have appetite suppression. Folic acid has now been published as of this year, January 2018, to stimulate appetite in ADHD children treated with methylphenidate. It was a randomized double-blind clinical trial, 70 outpatients, 6 to 12 years of age. And group 1 got the folic acid and group 2 didn't. And the group that got the folic acid had significantly improved appetite. Wrapping it up, my friend and colleague Dan Burrus of the National Speakers Association, who is a noted futurist, has this great quote, and I heard it and it really resonated with me. He said, "Don't think either or, think both and." I would encourage you to not think either medication or holistic nutraceutical treatment. Think both and. If there is a need for medication, then let's use medication. But let's not foreclose on using medication in a knee-jerk, reflexive way if we have not truly elucidated and appreciated the pharmacogenomic endowment of these young people, what their genes are telling us, their nutrient deficiencies, and so forth. So let me wrap it up with this summary. What you can do. Number 1, get rid of or stop playing video games. And if you are an adult with ADHD watching this online at the Global Autism Summit, beware computer internet addiction. I cannot emphasize that enough. Beware, beware, beware. What would this manifest as? Obsessing with checking your email. Getting to the office and checking your email first thing and not prioritizing things. Checking Facebook constantly. Wanting to see if your posts are liked so you can get a little hit of dopamine. I would beware of that. And if you're the parent of an ADD or ASD child, I would be very careful with how much video games they play. There are some very useful tablet programs for children on the spectrum. Those are okay. The addicting shoot 'em up games are not. I cannot emphasize enough, and hopefully you will see how passionate I am about this in this presentation, about getting functional medicine testing. IgG food allergies, wherever you get it, make sure it's a good lab, are critically important. The organic testing, organic acid testing is important. Hair analysis is the best way to find out about nutrient deficiencies. Pharmacogenomic testing, especially MTHFR and COMT. And then conventional but sophisticated labs. So sometimes well-meaning doctors will check magnesium and zinc. What that means is what goes into the vacutainer is the magnesium or the zinc that happens to be floating by the needle when it's in the vein. It is not an accurate assessment of what the patient's general level of magnesium and zinc is. And the way you get that is red blood cell magnesium and red blood cell zinc. That is, the blood is taken, it is cracked open, the red blood cells are cracked open in the lab all of the elements gush out of the red blood cells and are floating around, and then the level can be obtained. And that is a 100 to 120 day moving average of where your magnesium and zinc has been. It's exactly the same thing, the same principle as glycosylated hemoglobin, which is used to monitor glucose in diabetics. I put down B12 and methylmalonic acid because B12 is frequently checked and methylmalonic acid is not frequently checked unless you or your child are seeing a holistic practitioner. Methylmalonic acid is a buildup product that is a reflective of whether or not you have adequate B12, whatever your B12 level says. So you can have a high normal level of B12, but if your methylmalonic acid is high, that means you need more B12. So I always check those two together. The third point kind of goes without saying: avoid over-reliance on medication. And then the holistic ways to treat ADD, either by itself or ADD and autism, address any MTHFR deficiencies. And that's not just for ADD, that's for autism as well. If you have an autistic child or someone on the spectrum that is obsessing about things and can't move off of their obsessionality, they have no problem paying attention. In fact, they're paying excellent attention on what they're obsessing about. But if that's going on, my mind wonders what their serotonin level is, and then it quickly jumps to, gee, I wonder what their MTHFR status is, and then it jumps to, and even if they have a good MTHFR status, I wonder about their COMT. So holistically, ADD, autism, or ADD and autism, I think you have to check MTHFR. Get a good quality fish oil with reasonable amounts of EPA and DHA. I'm not going to recommend brands. Replace the elemental deficiencies, magnesium, zinc, copper, and iron. Remember that iron sometimes doesn't tell you the whole story, and you have to get ferritin for the lab. Replenish the gut microbiome, the friendly gut bugs down in our intestines that help us digest food and can have anti-inflammatory properties. Use probiotics. Consider low-dose lithium. Consider rhodiola if indicated. That's for the COMT excess. And even though I didn't talk about it extensively in this talk, consider precursor loading therapy, where instead of using a stimulant or an antidepressant, you use L-phenylalanine or L-tyrosine as a precursor for dopamine, basically loading up the body with the raw material needed to make more dopamine, or 5-hydroxytryptophan, or 5-HTP, to help you make serotonin. And with that, I'm going to quote Jim Morrison of The Doors. He said, "There are things known and there are things unknown, and in between are the doors." I hope that this presentation has been very helpful to you and a doorway between where you are now and perhaps getting you or your child better. And I will tell you, first of all, thank you for attending. There's my contact information, but if you look at the yellow right in the middle, link to all slides from this presentation. If you go to that website, slideshare.net/LCadyMD, you can see every slide in this presentation, and you can watch it and focus on it as long as you wish. So thank you all very much for attending. It was great to speak to you, and I wish you the best in the Autism Global Summit. Thank you very much.